Hi, this is Dr. Krishna. I'm a urologist, andrologist, and a micro infertility surgeon. So today we speak upon small issues or little issues about the prostate. Well, what is prostate? Prostate is a gland which lies beneath the bladder. In an easier way to understand. So the urine has to go through the bladder, from the kidneys produced, it comes into the bladder and then it goes out through the urethra. So in between the bladder and the urine outlet, we have a bladder, prostate, and then we have a urethra. So now prostate develops, usually that is enlargement or enlarged prostate is found only in elderly males, usually more than 50. The symptoms usually occur after 50s or 60s or 70s, and usually prostate is not found in females. There is no prostate in females as such except for the embryological remnant. So now when we say prostate, we must say the symptoms of the prostate too. Well, what are the symptoms of the prostate? In the symptoms of the prostate, patient comes up saying that, sir, I have got multiple times increasing frequency of urination at night, especially usually 4 to 5 times. But normally is less than 2 times. If you wake up more at night, you will have the next day getting disturbed. And some patients will have urgency, frequency, increased nocturia or increased frequency at nights. Apart from that, they will have poor stream of urination, and then intermittency, and sometimes hesitancy. These are all the symptoms. Well, how can these symptoms be explained? It is very simple that prostate stands in between the outlet, from the bladder. If the urine has to get out, it has to go through the prostate. When the prostate, think of this is the prostate, and prostate is growing inside the lumen of the urine pipe. So the urine pipe becomes narrow. The narrower the urine pipe, the pressure increases. That means the bladder has to put more and more pressure so that it has to drain the urine. So what happens is when this pressure increases inside the bladder also goes into decompensation when it's a chronic outlet obstruction. So glorifying or simplifying way of telling is that the symptoms of the prostate can be divided into storage symptoms and voiding symptoms. In the voiding symptoms, you have irritative prostate symptoms. Irritative symptoms are in the sense urgency, frequency, and nocturia, and obstructive symptoms being thinning of the stream of urine, and patient is passing urine in a fashion like he gets urine but he passes intermittently, like stopping and passing, stopping and passing, and multiple times, and post-void dribbling. That means after urination, patient feels like, yes sir, I am having dribbling of urine. Apart from that, he says that, sir, I am having incomplete sensation of emptying of bladder. So he goes to urination again and again. And so when we see such a patient, and in such a patient, if the post-void residue is high, that means that after passing, usually the post-void residue in the bladder must be no less than 1/4 of the pre-void residue. That means usually the maximum you can take it around to be 50 ml. If it is more than that, then it's a significant post-void residue. In the significant post-void residue, urine might get well infected, and usually elderly patients or middle-aged patients, they can be diabetics, they can have certain other comorbidities too. So when the urine gets infected, their symptomatology increases much more than whatever I have spoken of. So now, the patient comes to the urologist, and then we evaluate him. How do we evaluate him? As simple as that, we basically do an ultrasound abdomen. We see for the size of the prostate, and then we see for the post-void residue. We make him do an uroflowmetry, and we also see his urine PSA levels up to the age of 70-75 years. PSA levels also count a lot. Then apart from that, we see for the routine urine examination, and urine culture is also done. So these are the basic baseline routine examination. Apart from the patient is having any comorbidities, we check for them too. And then we make a decision. In the decision making, if the patient is having mild symptomatology, mild to moderate symptomatology, the patient may be started well on drugs. There are certain alpha blockers and certain drugs which can be initially started. everyone knows these drugs that is called tamsulosin. Well, we have got multiple companies coming up. There are certain drugs which everyone knows. One is Veltam, Veltam Plus, and then Urimax. There are certain more companies coming up in the market nowadays. So with these tablet intake, the patient will have the alpha receptors which are there inside the bladder, they relax, and then the patient will get good amount of urine and his symptomatology decreases. Well, there is no consensus how long we have to take these drugs. When the patient says that symptomatically I am not well, patient may be investigated again, and if his symptoms are severe enough, or there are certain indications for surgery like severe LUTs, that is severe prostatic symptoms, and those symptoms which are not getting down by drugs, and if there is because of the outlet obstruction, if the kidneys are getting swollen and the creatinine levels are getting high, or if the patient is having bleeding in the urine because of the prostate. Well, these are all, and if there is a bladder stone, that means because if there are small stones coming up from the kidney, it is not getting thrown away because of the obstruction by the prostate. So these are all certain reasons when we think of the patient to have a prostatic surgery. So these are all the indications for surgery like I told you. Now, so how do we surgery? Well, sir, prostatic surgery can be open and laparoscopy. We better call it endoscopy. So the most preferred modality is endoscopy. That means we go inside through the urethra and we empty the prostate and we try to make a new pathway open so that the bladder directly empties out. So this is the easiest way of doing prostate surgery. Well, if you have a bigger gland, bigger size of the gland, then we may also go for the what you call open surgery too. Open surgery is also indicated at certain times if you have bigger size of the prostate, bigger stone, and if the prostate is a part of another surgery. So these are all certain indications for open prostatectomy. And now see this modern era of robots and all, these are all fashionable eras. So even robotic prostatectomies are very famous in US. But India is all about economy, so you better go through the economy also. Now, these are all the symptoms of the prostate and the examination, and you better consult a urologist when you have prostate, sir. But one thing is for sure, size of the prostate never equates to obstruction. It is the growth of the prostate inside the lumen which causes obstruction. So just don't go by the size of the prostates. People may get misled. It may be correct, it may not be correct. So it is better that we have an objective assessment of the prostate obstruction. That is usually done by a post-void residue in places where we do not get uroflowmetry. So that it is better that you meet a urologist and then get treated for the prostate, sir. Well, you have certain problems with the drugs, but drugs are real good, and for a patient with mild to moderate prostatic symptoms, drugs do very well. So this is the best things I can tell about prostates. And serum PSA is also one of the investigation which is done for the prostate. If PSA is raised more than 4, then he better be evaluated also for why it is raising. It can be because of any reason, okay. And significant PSA rise has definitely to be evaluated. So with this, so I believe I have covered a bit of prostate. Thank you, sir. This is Dr. Krishna, urologist, signing off. And namaste.